President of the United States did an interview with Chris Wallace over the weekend. It aired yesterday. And I've always had some respect for Chris Wallace. I think he's pretty good at what he does. I think he's fair for Fox News, and in this day and age in journalism, I think he's probably about as fair as you can get. And the interview with Donald Trump was, for lack of a better term, stunning, I guess you could say. I guess I wouldn't be surprised with some of the things that Donald Trump has said in this interview. So we're going to go over it step by step. But of course, a big topic, and the topic that Chris Wallace started with, was the coronavirus. And Donald Trump immediately got upset at the start of the interview when Wallace pointed out that the United States has the 7th highest COVID mortality rate in the world, and accused him of saying we had the worst rate in the world, which he never said. Have a listen to this.
I think it's the opposite. I think we have one of the lowest mortality rates in the world. We're going to take a look.
We had 900 deaths on a single day.
We will take a look.
This week.
Ready?
You can check it out.
Could you please get me the mortality rate?
Yeah.
Kaylee's right here. I heard we had one of the lowest, maybe the lowest mortality rate anywhere in the world. Do you have the numbers, please? Because I heard we had the best mortality rate.
The case rate of similarly situated countries, as Dr. Burks points out, and this is
number one low mortality rate. I hope you show this scenario because it shows what fake news is all about. Okay,
I don't think I'm fake news.
So he calls Wallace fake news. And by the way, Trump is absolutely wrong. We don't have the lowest mortality rate. That's absolutely not true.
Well, we're also not the number 7 highest either, though, Brian. I think we have a 3.4%, and it's dropped significantly in the last few weeks.
Okay, well, that's not what Donald Trump said, though. Donald Trump said we had the best, and
we definitely do not have the best.
Absolutely,
that is an incorrect statement.
Well, he made a lot of incorrect statements. That was certainly one of them. Trump also claimed that cases are only up because testing is up. He compared some cases to the sniffles, by the way. Have a listen to this.
But, sir, testing is up 37%.
Well, that's good.
I understand. Cases are up 194%. It isn't just that testing has gone up, it's that the virus has spread. The positivity rate has increased.
Many
the
of
virus
those
is
cases,
worse than it was.
Many of those cases are young people that would heal in a day. They have the sniffles, and we put it down as a test.
That's true.
First of all, for anybody, especially the President of the United States, to compare the coronavirus to the sniffles is beyond irresponsible.
You're conflating what he said, Brian. He's saying many of those cases. He's not saying every single case is, which is true.
It is.
Many of these cases are very, very, very mild for
Here's
young
why
people.
that's very irresponsible.
It's not
to make
irresponsible.
Okay.
It's accurate.
So let me give you some accurate stuff. And by the way, the coronavirus should never be compared to the sniffles. Period. It just shouldn't. Because last I checked, nobody old is dying from the sniffles.
Again, what he is saying is that for many young people, when they get this virus, they get something like the sniffles. Their symptoms are extremely mild. He's not suggesting that nobody's getting sick from this virus or nobody is dying from this virus. Obviously, that's not the case.
All right, so here's the problem with that. That's not what he said. Now, you could say, well, here's what he was trying to say.
That is what he said.
Or here's what I meant he was trying to say. That's not what he said. And I'll tell you something. I am very close to a friend of mine who is somebody in the front lines who is in the hospitals here in Las Vegas. I'm not going to say who this person is. I was having a conversation with this person yesterday. Again, this is someone who is treating COVID patients. This is somebody who sees it every single day. She told me in the last week, she's checked in at least 2,000 people, 2,000 COVID patients from Arizona and Oregon. And they are telling her in the next week, it could be up to 20,000 patients in Las Vegas, not just people who are positive.
What you're saying into hospitals?
Yes, not just people who are positive. People who are positive and need to be checked into a hospital.
So then why are total hospitalizations sitting around 956?
That's what she told me. She's in there. She works in the hospitals.
I believe that she is probably incorrect.
Okay, well,
otherwise,
you can believe that.
That's one
You
nurse.
can believe that if you want.
Otherwise, if that's the case, then our hospitalization should be somewhere between 12 and 15,000.
Well,
they're nowhere near that.
She didn't say 12 and 15,000
She said
in the last
2,000.
Right. So I don't know where you're getting the 12. I'm saying in the next week or two, they're being expected from Oregon and from Arizona up to 20,000, not just COVID positive cases, but cases of people that are very sick that need to be hospitalized. So while all this is going on,
well, you have people that were that got sick and did not get treated because they were afraid to get the virus. You also have a lot of people that have missed their cancer screenings. I mean,
this has nothing to do with cancer
There's definitely
screenings.
a lot of sick people.
Okay, but this has nothing
right
to do.
now.
This has nothing to do with
cancer. The state of Nevada
screenings.
has a little over 950 hospitalizations.
Okay,
Brian.
but
a
this
lot
has,
of cases. Yesterday there was 1,228 cases and 1 death, but the mortality rate has now dropped to a solid, like a 1.80%, which is by far the lowest of any Democratic state in the country with over 10,000 cases.
I'm glad you brought up the mortality rate, because that was going to be the next thing that I was going to talk about. Vegas Casino Union, since Steve Sisolak opened up the casinos, 22 deaths of workers and relatives. This is horrible. This is horrible, but you're not going to hear these stories in the mainstream media. You're not going to hear that because the casino executives don't want you to hear this. So now the Culinary Workers Union and the affiliated Bartenders Union, Local 165, they said in a statement that hospitalizations for its members, their spouses, or dependents have climbed 800% since Sisolak opened up these casinos on June 4th. So obviously what the Culinary Union, what they are asking for is they are asking for safer conditions for the employees. And I don't blame them for doing that. 1 death is too much. But since Steve Sisolak opened up these casinos, 22 people have died in direct correlation to opening up these casinos. There is a reason why the casino executives in Las Vegas are not telling their employees who get sick. They're not telling their employees anything. And if an employee finds something out, if their friend tells them, hey, I got COVID, they're not allowed to tell anybody, which I think is absurd. It's ridiculous because they're keeping it quiet for one reason and one reason only, and make no mistake about it, money. They want customers to flock to casinos. If you find out that 3 employees at the Bellagio, for example, might have gotten COVID, there's a chance that can hurt their bottom line, and that is absolutely absurd. You're taking the health of some of these employees and individuals. You're taking money over that, and I think that is wrong, and I disagree with it.
The issue is, Brian, this entire economy is predicated on the casinos and gambling.
All right. Well, you think economy?
I think economy because economy keeps people employed, keeps them in houses, keeps them able to feed their family.
Doesn't really do any good though if you're dead, though, does it?
Well, all those things. How you can't say that the casinos being shut down will not lead to significantly more deaths than 22 deaths, Brian, because they most likely will.
That's absurd. I don't know what you're talking
about. If 300,000, like for example, there's 300,000 Las Vegans right now that are on pace to either get evicted or default on their mortgage in September.
So you think more people will die if they're evicted than the coronavirus?
If more casinos get shut, well, you have to have shelter to live, Brian.
So you think more people are going to die if the economy isn't open than the actual coronavirus itself? That makes no sense to me at all.
How is this city going to exist? Where's the money going to come from,
You're
Brian?
talking about economics and money. I'm talking about death. We are talking
the two
about
are correlated.
We could not be on more opposite ends of the spectrum.
It's a cause and effect situation.
All right.
Brian.
Well, I know. Just like if kids don't go to school, they're all going to die as well. I know it's a right-wing talking point that Donald Trump in the White House
It's not
uses.
a right-wing talking point.
Yes, it is.
Brian, it's not. There's 30,000 cases of COVID-19 in California. Nobody under the age of 17 has died. Yet
that's under the age of 17.
Yet they are predicting that 5.5 million students aren't going to be able to go to school in the fall.
And show me the stats where kids are dying.
How many of those parents are going to... There's been 14 total deaths under the age of 15 in the entire United States out of 4 million collective cases,
And show me the stats that if kids don't go to school, they die. Because that's what Donald Trump is saying. And there is no stat in this country to back that up. It is a lie.
Show me the stat that if kids don't go to school, that their life is better.
I'd rather people not die than kids
Brian,
for maybe 6 months not go to school.
8,000 people die every single day in the United States and have for 10 years.
So we're going to compare car accidents to the coronavirus. That makes a lot of sense.
The mortality rate of every single human being on the face of the earth is 100%.
So because people die of heart disease,
89 people have died from the flu under the age of 15.
Now we're comparing the flu.
In the same time that 14 have died. The flu is actually much more deadly than the coronavirus to people under the age of 15 or 17 years old.
So now we're going to compare the flu.
How many parents are going to have to stay at home because 5.5 million students can't go to school?
So if I could respond. So now we're comparing the flu to the coronavirus again. I haven't heard that one before. That's original. And we're also talking about students not going to school, and if they don't go to school, they're in danger of dying. This is the stuff
Brian,
that
you said that
if
I
you're
didn't say
brainwashed.
that. You've said both those things. I have not said one of them.
Well, you
sound much more brainwashed right now than I ever will.
I'm not brainwashed at all.
I'm hitting you with data and facts, and you are.
No, you're not.
You are.
No, you're not.
Yeah, of course I am.
No, you're not. No, you're not.
I absolutely
Are
am.
kids going to die if they don't go to school? Where's that stat?
When did I say that?
The president of the United States
I said kids
that.
will be significantly worse off, as will their parents.
JD, the president...
Kids staying
JD,
at home
listen to me for a
and
second.
not being able to interact with other
JD,
children is
JD,
not good for their
listen to me for a
development as
second.
children.
Okay, you're
Brian,
talking about
or as human beings.
Well, it's not good for the development if one of their mothers or fathers die as well, but you're not taking that into
the
account.
chances of that are quite small, Brian.
Really?
Yes.
Really?
The mortality rate in California
Quite
is 2%
small.
right now.
Okay. Well,
there have been
all right.
391,000 cases and 7,000 collective
Okay.
deaths,
Well,
and 40% of those have taken place in nursing homes.
so
how often are children hanging out with their grandparents who live in nursing homes? Probably not very often, especially during times like this.
Okay, so what I refuse to do, which is what you do, and a lot of Trump supporters do all the time, but what you do, which I refuse to do, is to talk about 8,000 people that die in this country every day due to heart disease, due to car accidents. I am not going to compare those types of deaths, which is what you just did, to the coronavirus. That's the first thing I'm not going to do. Here's the second thing I'm not going to do. I am not going to say kids need to go into school because, they're not getting the virus and they're not dying when there is something called being asymptomatic. And there are adults that actually work in these schools. Now, if all the scientists and all the doctors and everybody say it's quite all right for kids to go back to school, fine. I am not going to listen, with all due respect, I am not going to listen to Trump supporters or Donald Trump or people in their administration say that it's safe for kids to go back to school.
You also
Hold on a second.
You also want to listen to Dr. David Samadi, Brian,
David
who came
Samadi,
on the show last
David
week.
Samadi is a fool.
He is a doctor.
No, he's not.
He is
not
doctor.
an expert when it comes to infectious
Neither
disease.
is Sanjay Gupta.
Did I mention Sanjay Gupta? I said
Is Sanjay Gupta a fool?
Did I mention
is Sanjay Gupta a fool?
Here's the way I'll respond to that. I'm not listening.
You're going to say no.
Okay, if you let me
Even
respond.
though he's not an expert in infectious disease either.
Do you want to answer the question?
You listen to a couple of doctors.
Do you want to answer the questions for me, or do you want me to answer?
because you agree with them.
Okay, so can I answer your question, or do you want to answer it for me? I didn't bring up Sanjay Gupta. You brought some idiot doctor named Samadi, by the way, who won't even appear on Fox News anymore because they don't want him on anymore. He's not an infectious disease doctor, and he's a fool.
Neither is Sanjay Gupta.
So that's number one.
Is Sanjay Gupta a fool?
If I can just finish my answer now. Number two, I'm talking about infectious disease experts. I'm not talking about people on TV.
You're talking about
I could finish my
Anthony
answer.
Fauci.
If I could finish my answer.
Okay, I'll let you
I'm
finish.
talking about scientists and infectious disease doctors. I'm talking about those people that specialize in this type of thing. I'm not talking about politicians. We should not be listening to politicians, certainly not Donald Trump.
Okay, so you're talking about Anthony Fauci, who said yesterday that New York did a good job of taking care of the virus. When New York, and he also said that you got to follow the science and the data, when New York has the worst science and the data in the country.
All right.
They have the most cases, they have the most deaths, and they have the third highest mortality rate. You could not have a worse set of science and data. But Anthony Fauci went ahead and said that they did a good job of containing the virus.
Brian,
12,000 people died in nursing homes in New York City.
There we go, the nursing home, right-wing propaganda.
It's not right-wing propaganda,
Yes,
Brian.
yes, it is.
There was a document that came out. Andrew Cuomo recommended that nursing homes take in patients from hospitals positive with COVID-19.
Okay.
And the virus
You
ran
keep talking
rampant
about
through these
things that
nursing
happened
homes and
months
killed
ago.
people.
I notice you keep.
Yeah, I'm talking about the science and
If I
data.
can respond,
That the doctors
if I can respond,
that you want to listen to have backed that is incorrect.
You keep talking about things that took place months ago, but I notice you don't want to talk about what's happening in this country right now. I notice that is everybody on the right. And by the way, in regards to Dr. Fauci, you took what he said completely out of context. What Dr. Fauci was talking about was not the initial response. He was talking about how they adapted. He is talking about where they are right now as opposed to a couple months ago. You completely took what he said out of context. Now, there are other parts to this interview that we are going to go over, folks, and we'll take your phone calls at 702-257-5396. Again, that number is 257-5396. Donald Trump was asked about the mistakes that he made along the way with COVID-19, and I want you to have a listen to this. Sean, can we play that clip?
I'll be right eventually. I will be right
understand.
eventually. You know, I said it's going to disappear. I'll say it again.
But
it's going to disappear.
does that discredit
and I'll
you?
be right. I don't think so.
Right.
I don't think so. You know why it doesn't discredit? Because I've been right probably more than anybody else.
So a few months ago, Donald Trump said it's going to disappear. It's going to disappear. So Wallace asked him about that, and Donald Trump's response is, well, eventually it's going to disappear. That's like calling yourself brilliant when you say eventually you're going to die. It might not be tomorrow. It might not be next year. But eventually you're going to be 6 feet under the ground. You're going to die. This is the president of the United States making idiotic statements. Eventually it's going to disappear. Just idiotic and stupid. Now, he was asked if he regrets not wearing a mask and if he supports a mask mandate. Have a listen to this response.
I want people to have a certain freedom, And I don't believe in that, no. And I don't agree with the statement that if everybody wear a mask, everything disappears. Hey, Dr. Fauci said don't wear a mask. Our Surgeon General, terrific guy, said don't wear a mask. Everybody was saying don't wear a mask. All of a sudden, everybody's got to wear a mask. And as you know, masks cause problems too. With that being said, I'm a believer in masks. I think masks are good. But I leave it up to the governors.
Okay, so first of all, when he says masks cause problems, everything causes problems, but it does not outweigh what the coronavirus can do to you. So for him to say that is absurd. Also, nobody is claiming that if you wear masks, everything is going to be perfect and everything is going to go away, which is what he said there. There is not one logical person, not one doctor, nobody, not one scientist, not one Democrat.
Actually, yesterday, the head of CDC, Robert Redfield, said if everybody wears masks in the United States, in 4 to 8 weeks, the virus will be basically gone.
He said in 4 to 8 weeks that, yes, the virus will eventually be gone. But he didn't say if everybody wears masks, it's going to be gone tomorrow. The president of the United States alluded to that, and I completely disagree.